owners, oops, and had the opportunity of working with many owners across the industry. And I'm excited to connect with you guys today to talk a little bit about the opportunities for home care agencies that are providing non-skilled services and what opportunities we are seeing in these markets. Now, a quick intro on Paradigm. Paradigm works with over 2,500 agencies nationwide, home care agencies, helping them connect with third-party payers from credentialing assistance to billing and education and growth support, which we'll talk about a little bit later on the call. Um, Before we get started, again, I do want to just iterate because I know there was some communication prior with regards to Medicare versus non-Medicare. This call will be focused on the personal care side, so non-Medicare. So I just wanted to, make sure that everyone that's on the call is able to provide services and interested in providing fee-for-service benefits, because that's what we're going to focus on today. I'm going to open up the call with the reasons and some of the understandings that we've seen across the industry on diversification. And then I'm going to dive a little bit into specific payers and how we are seeing the growth that's coming out of them. I'm going to hopefully have some time for question and answers at the end of the call. And I'll have my contact information if we miss something or we don't have time to get to a question. So without further ado, let's dive in and let's get started. So we talk about diversification, and as a business owner, many of you that are sitting on the call today are running your home care agencies. Some of you may have tapped into some of the opportunities within third-party payers. Some of you may have been on the private pay side of things primarily and focused on it specifically. And, when we look at some of the statistics in this marketplace, we know that private pay is one of the most popular, or is simply the most popular method of payment that we are seeing providers work with, as well as how clients are paying for care. Now, when we look at investing and we look at an investment strategy for our personal investments, we always want to diversify. So why wouldn't we do the same when it comes to our business? And why is that important? So let's start with number one, risk mitigation. If all of my money is coming from one payer source and there's an impact on that payer source, whether it's a larger economic impact on the marketplace or it's a smaller economic impact in the area that I'm working in, then I no longer have anywhere to get additional business if that payer source starts to dry up. And having diversified payers and working with multiple payers allows you to then focus your energy with another payer and expand on another opportunity so you're not stuck trying to get water from an empty well. The other side of this is really the competitive advantage. And that's where, whether you're working with a referral source or you're just marketing to your community and you want to be able to be a provider that accepts additional payers so that when people think of who the agency of choice is, they can say, well, that's a provider that can accept whatever plan I am, whether they know you can accept their payer or not. The fact that they know that you're accepting additional opportunities and additional payers will faster push them to have a conversation with your agency over another agency that they deem as a non-workable agency because they only take private pay. Also, for your referral sources to stay stickier in their brains when it comes to referring out their care, who's going to be at the top of their mind? An agency that only takes one type of client, or the one that they know that they can just send any client to and that agency will take care of them? There's also profit from a profitability standpoint. Some of these payers in certain markets are also paying more than they are in other markets. Now, everyone here is in the same state, so the reimbursement rates are relatively the same across the state. But depending on where you are in the state, your private pay rate may be lower than what the VA is paying. The other side of this is the community impact and the caregiver retention. So community impact is, as we said earlier, is who is a patient or a potential prospect going to think of when we look at choosing an agency, one that can support more of my needs than less. And for an agency that will accept any method of me coming to them and onboard me as their client, it's more likely that I'll refer them to other people. And it's more likely that I'll think of them and it will be stickier in my mind when I come back to them. And very importantly, when we look at caregiver retention, some of the most common things we hear from providers are that they can't retain their caregivers. And if you don't have hours for those caregivers, then there's a very big chance they're going to go somewhere else because at the end of the day, they need the business and that's what they want. Now, they could be very happy with the services they're providing, but if they're only getting 2 hours a week and they want more and you don't have more to offer them, they're going to go to an agency that could give it to them. In fact, I spoke to a provider who told me that the only reason they take Medicaid is for caregiver retention, and they have a handful of clients that they do just to have the extra hours. So, those are some of the reasons why we see diversification as a very important piece of growing your home care agency and growing your business. Now, if I'm trying to strategize as an agency, what is my goal? What are the numbers that I'm trying to achieve? Where am I trying to get as a business in the coming year or next year or 2 years or 3 years? Once I have diversification and I'm working with multiple payers, I can start to actually project what are the expected revenue streams or general or total revenue that I can anticipate from these payers. Now, the numbers you're seeing here are not precise to the state of Massachusetts. You would have to do this based on your cost of care and what the reimbursement rates are of the payers. So those are things you have to look at. But this is a chart that you can actually build when you're working with or looking into working with additional payers and how you can put it together to achieve your financial goals. So let's just give an example. If Medicaid is profiting $5 per hour, private pay is 10, and VA is 20, how many hours do I have to add? And how many clients do I have to add in order to achieve those goals? And I take those numbers, and now I know how much of my energy and how much of my time I want to invest into each one of these payer lines to achieve that. So that's one thing to look at. The next thing is attrition. And what we know based on many of the studies that we've looked at and looked into is that the amount of time that clients stick with us when it comes to third party payers are much longer than the turnover when it comes to private pay clients. And a number of potential reasons for that is that Medicaid is an underserved market. So, in many cases, they don't have alternative options or alternative places to go to or agencies to work with. The other side of that is that when a person is not seeing a direct impact on their wallet to pay for care and they're happy with the services, there's less of a reason for them to look elsewhere. Whereas with private pay, when the money's coming directly from their bank account and they're seeing the impact on a weekly or bi-weekly basis, they're going to want to ensure that they're getting the best bang for their buck. So, A, there's more options. B, they want to make sure they're getting the best quality of care. So, there's a bigger likelihood of them turning over to another agency when something doesn't go as expected. So, Medicaid and VA have a much longer lifespan when it comes to the turnaround from the studies we've seen versus private pay. And again, that's another thing to calculate when we look at investing in these uh, business lines. Another interesting thing about both of these pairs, or all three pairs we're going to talk about today, because they're all fee for service, it's very easy to set up a schedule on the hours of care that are going to be provided because you already know how much they're authorized for before you take on the client. So before you accept the client, you already have, say, 40 hours of care that are going to be covered that you could schedule in a rotation because they're already paid for it, they're already covered, and then the schedules become a lot easier to maintain because of the consistency. So what are the three payers that we have been working closest with and have seen the most growth with? They are Medicaid, VA, and Medicare Advantage. Now, we're going to dive first into the VA. And within the VA, there's actually a few programs that deal with home care. We're going to talk about a few of them and how you, as agencies that are either working today with the VA, can tap into them, or if you're not yet working with the VA, where you may want to look into starting to open up these opportunities in your area. Let's talk a little bit about the aid and attendance benefit. And the aid and attendance benefit is a pension benefit. Now, qualifying for this benefit does require wartime. It also requires that the veteran had served at least 90 consecutive days. And this benefit is available for both veterans as well as spouses and surviving spouses. The money that they're approved for goes into the bank account of the veteran, and it's anywhere from 1478 to 2727. This number goes up every year, usually based on the relative to the cost of inflation as well as cost of care. So it usually goes up by a few percentages every year. And the veteran or surviving spouse can actually choose how they want to utilize this money, whether it's for home care or for adult care, or memory care, or adult day, or a nursing facility. In the case of most of the people here, it would be put towards their home care. Now, the cool thing is that if a veteran qualifies for this benefit straight directly with the VA, it's not utilizing a third-party platform, they can actually be a private paying client because the money goes in their bank account, you charge them your private pay rates, and then they pay you as a private paying client. The other thing about this benefit is that it can be used on top of other benefits. And we're going to talk about stacking benefits in just a moment. Before we do that, I want to shift over to the VA's Community Care Network. This is the benefit that Paradigm finds itself engaged with most frequently. And the VA's Community Care Network was really established to allow for providers and veterans that needed care that was not able to be provided through the hospitals to be able to be provided through the community. And home care is a very important piece of this. Within the home care benefits that the VA authorizes, they have homemaker / home health aid, and they also authorize respite care. Now, a couple of important things to know about VA CCN in Massachusetts is that Massachusetts is actually under a third-party administrator for the VA CCN called Optum. And Optum was brought into the picture around 2019 to take on two roles in this network. One was credentialing and the other one was payments. So historically, you would sign a contract with the VA hospital, and that's where you would get your referrals from, and that's where you would provide your services to, and then you would submit your claims to the VA directly. The VA brought on Optum and TriWest for the West Coast, and they said that you're going to take over this contracting process, and you're also going to take over the payment process. I'm getting a little bit of feedback. I think somebody's mic is on. Oh, thank you. Awesome. So Optum is the third-party administrator, which means that if you want to join the VA's Community Care Network, you have to go through Optum. Once they contract your entity, they load you into the VA system as a vendor, as a provider, and at this point, you can now provide services to veterans, homemaker, home health aid, and respite. Now, the journey for a veteran to receive these benefits is that the veteran's always going to have to get approved by the VA because the third-party administrators really manage the relationship between you and the network. But the actual care is always going to be managed locally by the VA and through a VA hospital. So the veteran, if they're already receiving VA healthcare benefits, can have a consultation done with their primary care physician within the VA hospital or at a VA clinic to determine if there's a need for care. If the veteran is not enrolled in VA healthcare, they would have to first enroll prior to having a consultation done with a VA physician. But once they're in the VA healthcare system, they can have the physician do the assessment. If there's a need for care, the doctor will put an order through to the VA system so that a authorization could be created. And this authorization will always funnel through the case management at the hospital. So even though this process can start at one of your local clinics or one of your local outpatient centers, or even if there's a local hospital, there's only 176 VA medical centers nationwide that actually funnel the authorizations through there, and the case management will be based out of there. Will they work in the hospital? Since COVID, a lot of them have moved remote, so not necessarily are they physically there, but that is where the authorization comes through. Now, homemaker and home health aid are benefits that are usually approved within the same authorization. And that means that if a veteran qualifies from anywhere between 6 and 168 hours of care, you would get an authorization as the provider. The case manager would assign that veteran to one specific agency with that authorization, and that is the agency that provides the services. So even if a veteran receives some money from the aid and attendance benefit, and they get now an authorization for homemaker or home health aid, they can now combine those two benefits and receive additional hours of care. Respite is handled separate from the HHA. And that means that veterans that are receiving homemaker and home health aid benefits can sometimes qualify for additional hours of respite. And the same goes for the aid and attendance clients. Respite is authorized separate, it's billed under a separate billing code, and the reimbursement rate is also separate from the homemaker and home health aid. Now, if we're looking at what is a way we would see these these benefits stacked, this is the chart that we're going to use as an example. Let's say we have a veteran and they qualify for 20 hours of HHA. And now they get the aid and attendance benefit and are also getting now $2,700 a month. The veteran could potentially have doubled their weekly amount of hours because they're utilizing both benefits. Now, the things that the VACCN and this benefit with HHA and respite does differently than the aid and attendance pension is one, the VA's community care network benefit is only for the veteran themselves, not spouses or surviving spouses. And two, the care is for the veteran in their home. So there's no out of home care. The veteran's not choosing where they want to, what types of care they're going to receive, but they are able to utilize their patient choice to decide where they're going to receive that care. So when you get an authorization, it's going to be for personal care. You'll provide personal care. So it can only be for the veteran. It can only be in the veteran's house. That being said, to qualify for the benefit, it is a little bit or a lot easier in many cases for the veteran because they're not factoring in the wartime. They're not factoring in the assets and income in most hospitals as long as there's a service related or service connected disability. And this gives room for a lot of veterans that maybe have been denied from the aid and attendance or maybe are paying out of pocket and never knew that there's an opportunity for them to tap into this benefit. These are these are ways where benefits are not being given to these veterans simply because they don't have the information. And your role in your market, if you're contracted and enrolled with the VACCN and able to help these veterans, is to bring that information to them. Now, I want to talk about one more benefit that actually doesn't have the full-time caregiver under the agency, but does have an opportunity of engagement with home care agencies, and this is under the veteran-directed care. So the VA over the last year started to launch these veteran-directed care programs so that certain qualified veterans can receive the care from a family caregiver or a caregiver of their choice and is reimbursed directly by the VA. Within that, they have the PCAFC, which is a program for comprehensive assistance for family caregivers. And this program is where the family caregiver is entitled to certain benefits if they qualify as the caregiver for their veteran member. One of the benefits that they're given is at least 30 days of respite care per year. So that means that these potential clients, these veterans, that even though they're receiving care today from someone in their household, they're eligible for a minimum of 30 respite days. And those respite hours and respite authorizations are usually going to be fulfilled by a home care agency. So even if you don't have the opportunity to work with that family while they're receiving the care from a family caregiver, you will have that opportunity to potentially get those respite hours. What is a good way for you to be able to interact with that benefit? And this is where the VA offers the program for general caregiver support services and where you could provide value. If you're credentialed and contracted and working with the VACCN, the caregivers are eligible for peer support mentoring and skills training. These are things that you could volunteer to support and provide for your VA hospital. And if you already have a relationship established with your care coordinators and caseworkers, you're reaching out and saying, hey, we want to be able to offer free mentoring and free skills training for family caregivers that are working with veteran directed care benefits. And what's the benefit for you? is that the impact that you have in the marketplace by connecting and helping veterans' families navigate these benefits, as well as offering the support, will in turn, in many cases, have them come back to you as a client, potentially for respite hours, and potentially in the future, if they're no longer providing services, even as a HHA or homemaker hours. So, what are some of the ways that we have seen providers tap into their markets and really dive into these opportunities? Getting back to basics. Number one, market to your local organizations and communities. Every referral source that you have today as a referral source can be a potential VA referral source. When we look at some of the statistics and utilization in this benefit, we see that many millions of American veterans that are senior veterans are not utilizing these benefits. They're not tapping into them, and it's usually because of lack of information. So if you have clients that are currently in your census that are paying out of pocket and you're contracted and you could provide services and they could subsidize those services through the VA CCN, then that's one opportunity. But if you're talking to your referral sources, make sure they know that if they have veterans that are coming through, that they're connecting them to you. Why is that important? Because now you can help these veterans navigate the process. And if they qualify for additional hours of care, even if they qualify for aid and attendance, or they still want to pay for additional hours out of pocket, there's still an opportunity for these veterans to be able to qualify and receive this benefit. Secondly, when you're going to your either VFWs or Elks Lodges or other centers that have a lot of these veterans, you can host lunch and learns. You can host outings. You could host different events to be able to connect the veteran community so you can teach them as veterans. You are able to tap into certain opportunities and certain benefits. These are what they are. And being that advocate and being that person in your marketplace that veterans and veteran families know they can rely on only helps you establish yourself so that when someone is a veteran and they do need care or they know someone that needs care, they're going to refer your agency. Lastly, once you're already working with these VA hospitals or working with some veterans, now you're already you're in the network. Start to actually engage and nurture the relationships you have with these caseworkers. Many times people ask, how do I engage with the caseworkers? I've only heard from them once. I reach out to them and ask for referrals, and they keep telling me no, or they keep telling me they have my information on file. And many times we forget the human side of this, where there's a personable component where these caseworkers at the end of the day have to get these veterans care, and they have to do it in the most efficient way possible so that they don't have a pile up and a backlog of 2 months to bring on new veterans. And usually what we see is that veterans that help, sorry, not veterans, but agencies that help make that process smoother tend to get more organic referrals. So even if you have a difficult time connecting with your VA, if you're actually working with veterans and they're going to the VA and requesting to be authorized and assigned to your agency, again, you have to be in the network to be able to provide these services. But once you're there, the engagement is going to happen regardless because they're going to be assigned to you. You have to get back in touch with the caseworker and you got to let them know that you're taking on the case. And that's where you can start to show that, hey, we're an agency that's not like the rest of the agencies. We care about the veterans. We're not just looking to add hours and just get more business. This can go a very long way in expanding and helping you establish yourself within your VA market. Before I jump on to Medicaid, did anyone have any questions about the VA CCN specifically? I'm going to try to do a quick question break between each segment of this call. And if you want, you could chat them in the chat box and we could address them. If not, we'll just continue and you could save the questions to the end.
Do you know if you have to be in network with Optum or Community Care to provide care to a veteran?
To provide care to a veteran, you don't have to be, but to get reimbursed or to get an authorization and to get reimbursed by the VA, you do have to be in the network.
Like if you get a veteran And can't you just bill the VA?
No,
Uh,
no. You always need with this program specifically, you always need prior authorization. Now, there are rare cases where the VA today will still do an out-of-network authorization. You don't really see it much. You don't really see it much, but that is a small possibility. But even in those cases, the VA is still giving a prior authorization. For aid and attendance, you don't.
for aid in attendance, you don't need a prior authorization.
No, the veteran gets qualified and can get qualified on their own, and then they can go and choose the agency they're going to work with.
But for the hours that they get per week,
That's that's the authorizations. So the authorization will be determined based on the numerous factors, and then an amount of hours will be assigned to the veteran. So let's say they say 20 hours a week. Now they have to assign that veteran to a specific agency, and they give the agency an authorization letter, and the authorization says you can provide up to 20 hours of care for this veteran. This is what they need, um, and then that will also have on an expiration date. So it can be, usually they're a year long if they're a long-term client. If they're a shorter term client, they may do a 30 or 90 or 180-day authorization.
okay, because I just heard yesterday, I talked to the VA and the lady said that she was like, you'll get reimbursed 70%, but that's what she said.
Without an authorization,
She said with an authorization, you will be reimbursed 70%.
unless she has that to you in writing, I would be cautious of taking on the client, because you don't really have an escalation path if you don't have a contract with the payer. They're not really entitled to pay you unless it's a VA. Again, unless it's a out of network authorization that they're writing, that they're giving you as an out of network authorization, and then they're going to have you build a VA for it. And that might be the scenario here where they're giving you that out of network authorization.
Mm,
And when she says 70%, I assume she's referring to the state's fee schedule and not to your private pay rate.
yeah, she's talking about whatever the fee schedule is.
Got it. So that would then be, Massachusetts now for HHA pays 38.12. So if we did that times 0.7, the reimbursement would be 26.68 an hour. Is it possible? If it's an out-of-network authorization. If it's not, you're going to probably run into issues when you go to bill that.
So I would have to get it in writing.
I would say get it in writing just so you have an escalation path, but you still may run into issues. You're probably better off asking them to push Optum to actually add you to the network, so you can just take veterans as proper clients. Um, they can probably request an expedited enrollment for you from Optum if they really need a provider in your area.
Okay.
Yeah, but that's something I would say we can take that offline and continue that conversation. But either it's an out of network authorization, I would utilize the opportunity to try to get in network so you can actually provide services and be a part of the VA community care network.
Okay.
All right. Awesome. So I don't see any other questions came in. So I'm going to move along to Medicaid. Medicaid. So when we look at Medicaid, historically, people have seen it as not the most pleasant word when we think of home care, and I think a lot of that is starting to change. Before I dive into the opportunities there, I see that somebody just asked a question. So Is there information on how to contract with Optum? Okay, that's a good question. Sorry, I'm going to go back for a second and we'll go back to the Medicaid piece. Um, the instructions for contracting with Optum. So they do a credentialing and then they do a contracting period. Now, Optum doesn't accept providers in every market. They have markets where the VA has as oversaturated, and they have markets where the VA has as undersaturated, which means that they actually need providers in. The If you're doing it directly with Optum, you're calling their 1-800 number and putting the request via phone. And then if they're going to open the case for you, they would give you a case number, and then they would send you via email a credentialing application. Once that application is completed, they would then approve it and then send over a contract to sign. Once the contract is signed, they would then load you into the VA's network and give you an effective date that you would be live as a provider. There are also cases where you'll call and they'll say you're in a saturated market and they will just give you a reference number. And in those cases, that means that they're probably not going to push your enrollment anytime soon. Option number 2 is, and we'll talk about it at the end, Paradigm has a credentialing team we can look into. Once we have the information, we work with Optum to determine your market and if there is a need in your market. And if we're able to then push forward with the credentialing, we would help facilitate that application process and bring it to the finish line. If you want to call Optum directly, let me just put the number in the chat box. And then we will move on. Perfect. Awesome. So, Medicaid. What are the opportunities that we see in Medicaid? Now, the reason why this is important is because usually when we think of Medicaid, we think of all the challenges, which we'll get to. But when I see a market that has challenges, I generally like to think of the opportunities that that's actually bringing in front of me. Because if there are issues there and people don't want to engage with it, that means that there is an opportunity for me to engage with it and potentially take a larger part of this market share. So, a couple of important things to know when it comes to the Medicaid side, and specifically in Massachusetts, is that Medicaid has different programs and they have different managed care organizations that they work with to actually manage these programs. Similar to the way that we showed with VA, they brought on Optum. Medicaid has a little bit of a different approach where they have what we call managed care. The managed care organizations, we'll jump into that slide in a second, are many. And these different organizations manage both contracting as well as payments and care for the clients that they're responsible for. So that means that a client could potentially be under a certain Medicaid program through United, and a different client could be receiving care through the same program but under a different payer, like My Care Family. Now, what this brings about is, when we look at the opportunities of working with different payers in our marketplace, is that we need to know who are the MCOs that are accepting providers in my region, in my area, and which are the waiver programs that I want to work with as a provider. The other thing is EVV. Now, currently in the state of Massachusetts, they have provider's choice, which means that as long as you're keeping that data in either a scheduling system, or if you're not utilizing a scheduling system, probably want to be able to keep track of the either GPS clock in, clock outs, or telephony system to be able to validate that the care is actually being provided. And that means that you don't actually have to utilize a third-party aggregator like we see in many states. But when we talk about EVV and the electronic visit verification, it's important to understand that there is a possibility that Massachusetts in coming years can bring a third-party aggregator into the state. And the direction they go with this could be either with an open or closed model. What that means is that if it's an open model, your current scheduling system should be able to integrate and you can use it as your clock in and clock out system, so your scheduling system, and the data will push over to the state's aggregator. But if the state in the future decides to go through a closed model, they may enforce providers to actually use a state sponsored system to clock in and clock out. EVV was set up or really kicked off in 2019 with the Cures Act. And the goal of this was to be able to prevent fraud because there was a lot of fraud going on in the personal care market. So, right now in the state of Massachusetts, the EVV is provider choice. It's not really much concern around that, but just something to be aware of what EVV is and what it could look like in the future. And then, secondly, with the MCOs, and as we see at the bottom, the reimbursement rates. So, a couple of important things to note on that is that these managed care organizations, even though they don't have to, they could contract at a different reimbursement rate than what the state publishes through the state's fee schedule. And every state pretty much manages Medicaid on their own, even though it comes down from the through CMS, each state has it set up different than the state next to it. So even if you're speaking to friends outside of Massachusetts and they're doing work with Medicaid, it doesn't necessarily mean that their system works for Massachusetts. But when we talk about the opportunities, each one of these MCOs may have a, a whole bunch of additional potential clients that we can be working with. And we may be able to contract with them at reimbursement rates that will cover the cost of care and make this an actual lucrative business line for us. Now, what are some of the challenges that we have to be aware of when we work with Medicaid? Because if we're going down this path and we want to commit to it, we really want to know what's in it for us. We already know that there's an opportunity because it's an underserved market. We know that they tend to authorize more hours than other third party payers like VA and Medicare Advantage. So, just from a volume standpoint, we're seeing a lot of uptick and a lot of volume being moved through the Medicaid market. Also, the spending on Medicaid is a lot more um, for home care and long term support services. So, over the coming years, we may see a lot of changes to these reimbursements and the reimbursement rates. But what are some of the things we need to be aware of if we want to embark on this path? Or if we're already working with these programs, just to be taking extra precaution around so that we don't run into issues at a later point. And the first thing we know is changing regulations. This is something that we see very commonly with Medicaid. They'll put out a bulletin and we'll see some sweeping changes that come into effect. So being on top of these changes is very important and really vital for continuing to allow your Medicaid business to function. Because if they do, for example, implement a new EVV standard across the state and they change the regulations for EVV, you as a provider have to be in the know and have to be on top of ensuring that you're putting these changes through to your agency and your processes so that you stay in compliance. The other side of this is also eligibility. We spoke about the different managed care organizations. Sometimes a client will come to us with an authorization and we'll put it into our scheduling system and we put it in for 6 months, but then the client goes out and moves to a different plan, moves to a different payer. Now that client, even though they have the authorization, is non-eligible for the care that they're going to receive. And therefore, we need to do client eligibility checks to make sure that this is not something that's occurring with a client of ours. Usually, these changes don't occur more than once a month. And that's why, for example, at Paradigm, we check all of our clients' eligibility in Medicaid on the 1st and 15th of every month. That ensures that if we see something, we can convey that information to you, the provider, and you could address it with the caseworker or the client before you provide care that may not be billable. We spoke a little bit about the EVV and what it could look like in the future and what it looks like today, but keeping that EVV documentation and keeping a very strong record of all the care that you provide and a paper trail of those hours of care so that if there is ever an audit, you have claims and you have care logs and care notes that match everything that was submitted is very important because you have to be audit proof. And we know that Medicaid does audit more than some other payers. So keeping these components and keeping these pieces of data safe is going to be a very important piece. Timely billing and reimbursements. When you get a contract from a payer, you have to look at what the timely filing looks like. We know for the VA and Optum, for example, it's 180 days. if you don't submit a claim within 180 days of date of service, you're not going to get reimbursed. But knowing these timelines is important for Medicaid, especially if you start working with multiple managed care organizations. And the reason is because if one payer has a 30-day timely filing and another payer has a year, you know that you have to have someone on top of those 30 days more than you do on those 365 days. Because once you miss the timely filing period, it becomes increasingly difficult and almost impossible to get reimbursed. The other thing that multiple payers brings about is different denial and appeal processes. So when you work with each additional payer, you're going to have to set up with that payer portal, and you're going to have to work through each one of these payer processes to get a claim paid potentially, or when it gets denied, escalated. And all this brings about the administrative burdens. So these are things we need to take into consideration before we embark down credentialing with the state, setting up with a managed care organization, and actually starting to go out and provide services. But again, because of some of these things, people have shied away instead of tapping into the opportunities. And instead of future proofing their agencies, even by taking on a small percentage of these clients, they've completely walked away from it. And as they are having impacts in other areas of their business, they're struggling to find additional revenue sources. And while we're on the note of managed care, I want to pivot over to the Medicare Advantage. And Medicare Advantage has a few similarities to what we spoke about in the with Medicaid, but there's a few key differences. Let's just talk about some of the different plans that we see offering support services for in-home care in Massachusetts, and what are the opportunities we see with them. So Medicare Advantage is a relatively newer, or the personal care component of this is relatively newer when we look at in-home support, but we're seeing plans be added and we're seeing plans also drop off over the past few years. And I'm going to show you a graph in a second of what that looks like. But what are the advantages of being contracted with a managed care organization when it comes to Medicare Advantage? So number one is it's a pure managed care model. And that means that you don't have to have an EVV in place. You don't have to first set up with the state and become a Medicaid provider or Medicare provider to be able to provide Medicare Advantage. You can go straight to the payer and get a contract. And if that payer contracts you, you could then provide services to their clients that have approved Medicare Advantage plans for in-home supportive services. Now, we know that right now a lot of these payers don't authorize a lot of hours, but we also know that that is very likely to change as the data starts to pile up and these payers are able to see the impact of home care versus readmissions and rehospitalizations, just like we've seen with other fee-for-service benefits around the country. And aside from just being able to be future-proof in your agency by holding these contracts and having the ability to service these clients, back to what we said in the beginning, it's another thing that you can add to your resume when you're going to your referral sources and saying, we accept any client that you have with any payer, there's something that we can do to help them. Now, it's a fee-for-service model, so there's an hourly reimbursement rate, and the amount of care that's authorized is usually at a maximum, but you provide based on the hours of care, you get reimbursed. You contract directly with each individual managed care organization in your area, and there's actually a way for you to check on Medicare's website. You can go and identify the plans that are providing in-home support services in your specific zip codes. And depending on how big your region is, if you're covering multiple Medicare localities, you may even see different plans in different regions that you service with the ability to provide in-home supportive services. Many times when you call these payers to get the contract, they'll confuse Medicare and skilled, and they may say you need to be skilled or you're looking to become a Medicare provider, you got to first get Medicare certified. It's important to just understand when you're talking to them to say, no, we are personal care providers looking to provide in-home support services for the plan that we see here offers it, and see who they can put you or move you over to, which contracting manager that can help you get started with that process. There isn't a fee schedule, so those rates are going to be determined based on payer. Over the last 4 years, we've seen a lot of growth in the amount of plans that are offering in-home support services. And this is important because we look at this and we know the direction that we're seeing with Medicare Advantage and where it's going to continue to go in the coming years. Now, when you look at these plans, it doesn't mean that 1,000 payers, it means that 1,000 plus plans offer. So you can have one payer like Humana that has 10 plans that offer such services. You can also have maybe that same or a different payer like United that only offers it for one of their plans and not the other one. So it's important for you as a provider to identify who is in your market, which managed care organizations are there, and if there's an opportunity for you to engage, where I don't see any negative side to going through and engaging with these MCOs, um, there is an opportunity there. So, how does Paradigm come into the picture? Paradigm, we are focused on helping agencies grow with third party payers. And at the core of all that is the billing. And what does that look like? For any of the payers we went over today, Paradigm's aim is to automate this billing process so that when you're finalizing the billing in your scheduling system, that's the last point of your journey. And that means for VA, we're able to scrub the shift data against the authorization data to make sure before we submit a claim it's accurate and the reimbursements are right and there's no overages and there's corrective coding. And with Medicaid, it's validating the information, checking the eligibility, and putting the data into the state's portal, tracking it until until the payment comes through. We reconcile that payment data and we post it back into your scheduling systems so that you can focus on providing care and growing. When it comes to payment escalations or denials, whichever payer you're working with will handle the denial and escalation process across those payers on your behalf. Because we're doing a lot of this scrubbing prior to actually sending out the claims or letting the payments go out, we're able to actually catch most of the issues prior to even submitting a claim so that we are able to achieve what we're seeing today, the VA close to 100% first pass success rate. We'll also notify you if there's overages or if there's issues or if you're billing the wrong rates for a certain client. And like this, you can also make those corrections in your system. We'll make the corrections obviously before we submit the claim to make sure it's accurate data. Credentialing support we spoke about on the VA side. If we're able to help your agency get credentialed, if your agency falls into an Indian market, then our credentialing team will work with you, get the application through, get it over to Optum. And from there, we can then focus on making sure that you're loaded correctly into the network. And as you're contracted and loaded into the network, we would then support you from growth support and education and next steps. So which portals do you need to set up? What do you need to do next? Where do you need to go? We help provide that guidance so that you can go out to the market and really start tapping into these opportunities. Historical collections for VA. If you have any claims from the last 180 days that have not been paid or been denied or been short paid by the VA, we have a dedicated audit team that does a 180-day recap. And we look at that information and we make sure that if there's any opportunities or missed payments that we can get escalated, we get them out the door and we get them paid for. And client eligibility we touched on, but authorization management is limited really to the VA hospitals. Some VA hospitals support HSRM, which is the VA's Health Sharing Referral Manager. And when they do work with HSRM properly, Paradigm can actually actively help you with renewal requests for those authorizations for your VA clients. In the case that we cannot put those renewal requests through for you, we would still be able to set up notifications. So you as the owner are in check and you know when your authorizations are expired, and you can work with the caseworkers to get those renewed. And then we mentioned with Medicaid, we run those eligibility checks not related to the actual authorizations, but actual eligibility on each individual client to make sure that they are getting paid for. So that is Paradigm. My name is Max. I know we have a few more minutes that we could take some questions. This is my contact information. If you'd like to get in touch with us, you can shoot me an email and I'll direct you to the best point of contact uh, within our team to help you move forward. If you have additional questions or if you just like to book a call to learn about the opportunities specifically in your area, you can utilize the links over here to get in touch with us. My name is Max. Thank you guys so much.
Nice. Thanks, Max.
Awesome.
This call also will be recorded or has been recorded, and I will share the recording link with all of you. You can share it with your teams. And a few people weren't able to join us at this time, so they'll get that as well. Max, are you able to share these slides with me and I can send them as well?
Absolutely. Absolutely.
Great.
And you could share that with the recording.
Yeah.
Awesome.
Anybody have any last thoughts for third-party billing for Max? Is anybody doing it now? Or is this
I have
new?
I have a question about the managed care organizations. So, are we able to contract with this managed care organization in Massachusetts? Because I've tried several times with CCA, and they kept telling me I filled the form and everything, and they send a message back to me, an email telling me, "Are you contracted with ASAP?" Which is I think the aging what do you call it? Sorry, the agency on aging, right? And I've tried for several years now. Each time they keep asking me, "Are you contracted with ASAP?" So
This is for Medicaid, right?
this is for Medicaid, yes.
Okay. When it comes to Medicaid and the MCOs, when
Mhm.
Medicaid, you always first have to go through the state and become a Medicaid provider, and only then can you contract with the MCOs. That's
So
what
we are
makes
we are Medicare provider with the states under a different waiver program. But when we try to credential with these MCOs, they keep telling us you have contract with ASAP.
So what happens is many times that the MCOs may only support certain waiver programs. So in this case, for example, even though you're set up with the state for one program, this MCO only offers only works with clients that are receiving the other waiver program. So you first have to go back to the you mentioned ASAP it was called.
So the ASAP is they're in charge of the home care, the aging population in Massachusetts, right? So the contract is every 2 years or 3 years, depending on which ASAP. I think there are 30 something of them, right? And for CCA, they keep asking me, "Are you contracted with ASAP?" But we are Medicaid provider under a different waiver, which is I think I can't remember the waiver program, but they keep saying, "Oh, you have to." The email I always receive is, contact us in 6 months, or are you an ASAP provider?"
If you want to forward me that email, I could take a deeper look. But what we've seen in many cases when there's multiple waiver programs in a state is that you have to actually credential for each specific waiver that you're going to work with and the MCOs that support those specific waivers. So it gets a little bit tangy in there. There's one of two things that could happen. One is that an MCO can actually be already filled and no longer accepting providers. Another option is that you're only enrolled currently for one waiver and they're saying we can't accept you as a provider unless you're able to provide both of these services and you're enrolled for both of these programs. So you mentioned that you're enrolled with one Medicaid waiver and not the other one. That would possibly be the first step for you to be able to then go back to them and get that contract. That's what we see most times when it comes to MCOs. I can take a little bit of a further look into your specific case if you want to just forward me that email.
Okay.
Awesome. And we have just 2 more minutes, so if anyone else has a quick question, we could try to get it. If not, you can reach out to me privately. Alrighty.
Are you guys licensed in Oklahoma?
Are we licensed in Oklahoma?
Yeah.
And what do you mean when you say licensed?
Like,
Do we work with Oklahoma? Yes.
yeah, yeah, that's what I needed to know.
All 50 states we're working in.
Okay, good. I'm in Oklahoma.
Oh, nice. What brings you to the Massachusetts?
I
Take it
just
up.
saw it in a group chat late last night. I was scheming the group chat and I saw it and I was like, oh, I'll just attend it tomorrow.
All righty.
The Medicaid stuff is state specific, but VA is probably pretty.
VA is similar in Oklahoma because it's Optum as well. It's a different region. Medicaid is very state specific.
Very
Medicare Advantage is same idea, but just different MCOs. So yeah, I'm just gonna put my email address in the chat box as well. I see someone asked for it.
Yeah, and Optum, they were like, they said that they were definitely full. They're not taking on any more agencies.
So Massachusetts is a little bit more saturated for many areas in the state, but there's still areas that are accepting. So I would tell you that their call center is usually trained to just say, we're not going to be able to move forward. If you get in touch with us, we can take a further look into it and see if there's actually an opportunity for credentialing. Because again, the call centers for years have just been turning away providers, and sometimes they follow up, and sometimes they don't.
Okay.
It is what it is, but we're very much on top of where we can credential you. We're going to move forward and try to get you into network so that you can provide these services.
Okay. All right, I'll be reaching out.
Awesome. Well, thank you guys so much. It was good being here today, and I hope to hear from some of you.
Thank you.
If not all of you. Take care.
Thank you.